The coronavirus affects people of all ages, but especially those aged 60 and over. That's why community agencies that serve this population are responding in new ways, but also reminding us about what they do on a regular basis. To tell us what's happening in parts of Boston is our guest from the nonprofit elder service agency Ethos. We'd like to welcome its Director of Development, Meg Barhite. Thank you very much for being with us, Meg.
Thank you, Chris.
Meg, I know a lot of people have probably heard of Ethos who watch our show, but for the rest of the audience, tell us what you, because this is mainly about helping people live and age strong at home.
Correct. We are a nonprofit. We are based in Jamaica Plain, and we serve various parts of our program serve the entire city of Boston. And we are all about helping our older neighbors live at home with dignity and independence for as long as possible.
Well, one of the things I'm sure a lot of people might be worried about right now is getting food, because even people who are pretty mobile have to be careful about where they go.
Absolutely. So on a day-to-day basis, Ethos has a lot of programs to account for that, and we are employing all of those programs right now and rapidly adapting as things change. So number one is our Meals on Wheels program. We deliver Meals on Wheels to the entire city of Boston through a network of vendors and partners, as well as through our own in-house operations. And that program is still fully operational at this time. We don't foresee any changes to that. We are, of course, taking precautions. Our drivers are armed with gloves and masks and sanitizer, and they leave the meal and they don't have physical contact with the senior themselves. But our seniors who are enrolled in Meals on Wheels are still receiving those hot, nutritious lunches every day. And we are willing, ready, and able to accept new clients. So if someone is feeling food insecure, even just for this temporary period, we can get you connected pretty quickly with the service.
Now, ordinarily, we associate food insecurity with low income or something like that, but this is a different situation. So if someone whose problem is simply that it might be risky for them to go to a supermarket, can they sign up if they're the right age?
Potentially. There are some qualifying factors, and it's really situational depending on who you are. So the best way to explore that is to call Boston Elder Info, who would do an over-the-phone screening to assess whether or not Meals on Wheels is the right program for you. And they can be reached at 617-292-6211. And if Meals on Wheels is not the appropriate vehicle for a person during this time, or in general, we do have other options for folks. Through our home care program, we can do some grocery delivery services. Through our volunteer-based programming, we have volunteers who assist with accessing groceries, either delivering to an older adult or taking that older adult to the store and bringing them back, helping them with the heavy bags. Specifically, the volunteer programs, we're exercising a lot of caution right now, and we're being very careful about making new matches at the moment. But we have these vehicles set up that we can deploy in different ways to meet the needs today as the pandemic grows.
Home care, I guess that means helping people with housework ordinarily, but in the current situation with precautions around the virus, is there anything else they're doing?
Not necessarily anything new, but we're focusing on specific elements of the home care program. So at Ethos, we staff care managers, and those care managers work with vendor agencies who provide home health aides and homemakers directly into the homes of our seniors. So those folks working in the homes, all of the agencies we're working in, Ethos is working in close contact with them, as well as with the Commonwealth of Massachusetts and all the directives coming down through them to make sure that the folks going into the homes are safe. They're focusing a lot on sanitation in the homes, on personal hygiene for the folks, and those home health aides and homemakers can often help with food preparation and even accessing groceries. So that's a great way for folks to get those services. And then at Ethos, our care managers, who are essentially coordinating all of that for our seniors, they are doing wellness checks. They're screening people over the phone before folks go in the home to make sure that there are no present symptoms and no international travel within the past 2 weeks to make sure that it's safe. And if it's not safe for us to go in the home, we're looking at other programs that we can put in place, like Meals on Wheels and things like that in the interim to keep people.
You know, what I'm reading between the lines here is that this is not just about giving people food, because just having somebody go to a house, checking in on people, and even seeing some minor symptoms, I mean, that could be a lifesaver, couldn't it?
Absolutely. I mean, isolation is a huge challenge even without, the coronavirus pandemic. Over the summer, even well before this started, the Boston Globe published an article in June, I believe, that called elder isolation a crisis. It cited a survey that 2 in 5 older adults feel their relationships aren't meaningful, and about half feel that they're sometimes or always alone. So, that's a huge challenge as it is, and now folks are being told to stay at home and not go out to the places where they might congregate and socialize, and stay away from their families and friends. So it's a huge challenge, and we're trying to overcome that through some different vehicles, wellness checks being one of them, using our staff to check in on our clients as well as volunteers to check in on clients that they're serving. We're also moving some of our programming online, so we're trying to do some live streamed health and wellness seminars and health and wellness classes over the internet. We realize that not everyone has access to the internet in their home or to a reliable computer, but we're doing the best we can in the interim. So we have a few live stream events that we have planned. We ordered equipment last week. We're getting it set up today, so we're moving quickly to bring these things into people's homes and do what we can to reduce that isolation. We're also, we have folks who are calling us stating particular needs, and we are in the early stages of developing a way to mobilize volunteers to help meet some of those needs as well. So nothing official on that yet, but we're working on a plan to get folks additional contact with their neighbors in a safe and thoughtful way during this time.
This is Being in the News, and we're talking with Meg Barhite from Ethos. Meg, I normally think of mental health and physical health as on 2 different tracks, but when you're contending with coronavirus, they are in some way related, aren't they?
Oh, very much so, and especially when you add in isolation and the fear and the anxiety that all of this can provoke in folks. I mean, even just for myself, going to the grocery store and seeing those beer shelves kind of makes my heart beat a little bit faster, and I can only imagine that effect on someone who may have trouble walking or getting around and getting out to one store, let alone 5, to find toilet paper. So they're definitely linked. Ethos does have some mental health services that we are using, again, in a safe way, and we're updating that daily. We're doing a lot over the phone, and we are triaging the types of cases that we're able to assist and at what level. But we have, clinical interns and clinicians on staff that we're working with to connect people either with our services or other services in the community if mental health is playing a large role in what's happening right now.
By the way, one other alternative for people if they need food, there were places where they can go in public. There are some certain central locations.
Yeah, thank you for bringing that up. We have, Ethos has over 40 community lunch sites, which on a normal day offer a hot, nutritious meal and socialization opportunities to folks in the community, all free of charge. Most of those are now closed. We are not having the folks congregate to get the meal. We've transitioned many of them to grab-and-go sites, so folks can come and pick up a meal and take it somewhere else to eat the meal, so they still have access to food. What is open and when in the hours is changing rapidly as the centers that host those grab-and-go sites are changing their policies. We are trying to keep our website as up-to-date as possible, so please check www.ethocare.org for more information about where you can access grab-and-go meals.